Hyperinsulinism is a rare condition. It really is a complex condition where the beta cells of the pancreas release too much of a hormone called insulin. And insulin is a very important hormone that controls your blood sugar level. So under normal situations, the body makes just the right amount of insulin to keep the sugar between 3.5 and 5.5 millimoles per liter. But in this condition, the beta cells of the pancreas make too much insulin inappropriately for the level of blood sugar level. And because insulin is being released in excessive amounts and inappropriately, that causes the blood sugar level to drop. And that low blood sugar, we call that hypoglycemia. And hypoglycemia can be quite dangerous because the brain depends on a normal blood glucose level. And when your blood sugar is low, you can run into brain damage. And that's one of the key things we try and avoid in these children, is to make sure that the blood sugar level is controlled appropriately so that there's no risk of brain injury. There are two types of hyperinsulinism. There is the focal type, where there is a small lesion in the pancreas that makes too much insulin. And those patients we can now cure by removing the focal lesion under surgery, and those children can be cured from the condition. But the most difficult condition to manage is the one where the whole of the pancreas is affected by the condition, and that's called diffuse disease. And until recently, the condition was so severe in these children that nearly all of these children used to have the whole pancreas removed, because the vast majority of children that come to Great Ormond Street Hospital don't respond to any type of medical therapy. So we're now developing new therapies for this condition and trying to prevent us from doing this radical procedure in removing the whole pancreas. So we recently did some research on a new drug called sirolimus, which we're using in some of our patients. And we noticed that this drug worked very well in some of our patients and allowed us to prevent the major operation to remove the pancreas in these children. So what we want to do now is more research in this area and trying to develop new drugs like sirolimus and if possible, one day not to do any pancreatectomies at all in these children. I mean, if you remove the whole pancreas, then it's very likely that the children will develop another condition called diabetes mellitus. So it's the opposite condition that we look after. And diabetes mellitus really then means the child will be subjected to insulin injections for the rest of their life. They may need also enzymes to digest the food, because the pancreas makes enzymes to digest the fats and the carbohydrates. So if you remove the whole pancreas, then you can't digest your fats and carbohydrates. So it's really, really important, if possible, not to remove the whole pancreas and develop new forms of medical therapy to treat this condition.